Medicare, bankrupt by 2020, caused by Obamacare theft of Medicare. I am currently a recipient of Medicare. As with most younger people, they probably do not care about Medicare. It is only something for older people. Well, you are wrong. You should be concerned with it because it will affect you someday in the future. You may not care because you probably thought that it is health care that an older person gets when they reach 65 years old. Some, if not all, younger people probably think that it is free because they may believe that the paying of taxes now when you are younger and working will get you free Medicare when you reach 65 years old. Well, if you think this, you are wrong. When you reach 65 years old, you start Medicare. You then start paying the U.S. government Medicare insurance premiums every 3 months for the remainder of your life. The amount you pay depends on how much money you made during your working years. The more money you made during your working years, the higher will be your Medicare insurance premiums. Most people with health care benefits from working for a company are dumped off their health care benefits and are put on Medicare at 65 years old. So those young people who do not care about the cost of Medicare premiums better care, because when it becomes your time to start Medicare, it may be too expensive. I started my Medicare life in 2015. As with all people on Medicare, my Medicare insurance premiums criminally went up 20% in 2015, effective 2016. My Medicare premiums went up another 7% in 2017. This means in 13 months' time, Medicare premiums went up 27%. This was under the Obama administration. Medicare rates going up this much in a short period of time implies someone was stealing Medicare funds for other purposes. The U.S. government said yearly inflation during this period of time was only 2.7%. During this continued period of time, the baby boomers were going into Medicare. This is all the youngest members of Medicare. They are considered the ones who are in the healthiest condition. They pay their Medicare premiums and very seldom use the healthcare system. There should be many more years for this financial condition for baby boomer Medicare recipients, where there should be a surplus of Medicare funds. Why would Medicare announce that Medicare will be bankrupt by the year 2020? During the U.S. presidential election campaign of 2016, it was announced during the last presidential debate on October 19, 2016, as a debate question by Chris Wallace of Fox News. Since this was true, someone must have been stealing Medicare funds to bankrupt what should be a surplus of Medicare funds for now and the foreseeable future. They believe Medicare will be bankrupt by the year 2020, even though the massive increase in Medicare premiums being paid into Medicare by the massive amount of healthy baby boomers, and most of them will not be using up the premiums because they are too healthy. Even the average age of dying is at an all-time high of 85 years old, up from the average age of dying of 72 years old. This implies that the increase in high near-death medical costs will be delayed for 13 years. Again, this would indicate a surplus in Medicare funds and should be the expected financial condition for Medicare, not bankruptcy of Medicare by the year 2020. This again implies that someone is stealing Medicare funds for another use. So the politicians, former President Barack Obama and the Democrats, decided to use the surplus of Medicare money to fund all of this country's medical needs using the cover-up called Medicaid, or it can also be called federal government subsidies for Obamacare. This was easily done because CMS, the people that collect the quarterly insurance premiums from the seniors for Medicare for the U.S. government, also handles all the money for Medicaid. So it was very easy to just take the money or steal it and give it to Medicaid. So this stolen money can be used to subsidize Obamacare. I would not be surprised if they used the dirty, crooked trick to help that along in qualifying Obamacare people to get money from Medicaid. This is the same dirty trick used to qualify people for food stamps. How do I know this? Because I tried to see if I qualified for food stamps several times when I was unemployed. I did not qualify, even though I was unemployed and did not get any money from unemployment at all. I did not qualify for food stamps because I had too much money in my bank account. Then I applied again in 2013 and I qualified. Do you know why I qualified? It was due to the question asked on the food stamp application. they deliberately left a question off the application sheet. This question was, how much money do you have in your bank accounts and what are your bank account identification numbers? I was able to get food stamps for that 1 year. This is how they do it for all other federal aid programs, such as the food stamps program. This is one way in how they were able to steal Medicare monies to pay for Medicaid for under 65-year-old people and use it to pay for Obamacare. Another way to steal the money from Medicare to help pay for Obamacare is if they do ask for how much money do you have in your bank accounts, but they could just give a free pass to Obamacare applicants applying for financial aid subsidies and give them enough money to pay for Obamacare insurance. Another way is if Medicare or Medicaid ask how much money do you have in your bank account and the applicant lies on their application as to how much money they have in their bank account. Then Medicaid would deliberately not check the bank accounts to confirm the information or to see how much money the people applying for subsidies have in their bank accounts. They just give a free pass for the people looking for subsidies to pay for Obamacare. Another way the applicants can get by the question about how much money do they have in their bank accounts, they can set up a false bank account that has no money in it or very little money in it. They would not report the bank account that has the balance of the large amounts of money in it. Then they would meet the requirements for the amount of money they have in their bank accounts. If Medicare lets them do this without checking all of the applicant's banking information, then they are criminally negligent in their job or in conspiracy to supply stolen money to Obamacare applicants for U.S. government subsidies. This is easy enough to check and confirm. Look at all the files and bank records concerning the applicants and cross-reference it to Internal Revenue Service information. On November 2015, Obamacare insurance companies announced they were short on profits and it was going to drop out of Obamacare insurance business. They were desperate, so Medicare or Medicaid may have just gave them the financial subsidies. This is illegal theft of Medicare and Medicaid money. Not enough people were signing up for Obamacare is why they were short on funds. The U.S. government was lying about the real number of people who had signed up for Obamacare medical insurance. They increased the seniors' Medicare insurance premium rates by 27% in 13 months to subsidize Obamacare and other possible hidden agenda items such as salary increases for the employees of CMS, the people that handle the collective premiums for Medicare and Medicaid. The additional 7% increase from 20% in Medicare premiums happened in January of 2017. This was also done to steal more money for Obamacare. It was to give growth money to Obamacare to make it look like Obamacare was growing and thriving and satisfy the profit desires of the Obamacare insurance companies. This happened during the Obama administration. After President Obama left office, the Democrats got the hint from President Obama on how they can steal Medicare money at will. There is no one to stop them. No one caught them in 2016 or 2017. It was then announced in latter 2017 that there was going to be another 7% increase in Medicare premiums in January of 2018. The Democratic Party supporters of Obamacare wanted President Obama's named legacy health care program to continue, so the Democrats wanted to increase Medicare premiums 7% more in January of 2018 to give it to Obamacare people and give Obamacare insurance companies higher profits again and give Obamacare the thriving business look. The Democratic Party then thought and said, oops, we cannot do that in 2018. It is a midterm elections year. They learned their lesson as to why Hillary Clinton lost the presidential election of 2016 because the Democrats had increased Medicare premiums by 20%. The senior voters turned against the Democrats in the retirement states of Florida, Arizona, North Carolina, South Carolina, and Georgia. So the Democratic Party, Medicare, and CMS postponed the 7% increase in Medicare premiums for January of 2018. This is exactly what happened. There was no increase in 2018. The U.S. government from President Obama on back can be entirely charged with misappropriation of funds, conspiracy of misappropriation of funds, aiding and abetting in misappropriation of funds, obstruction of justice, and in receipt of stolen funds. The the U.S. government from President Trump's administration on forward, and the rest of the U.S. government can be charged with aiding and abetting, cover-up, or obstruction of justice and in receipt of stolen funds. Donald Trump's guilt and those that supported the ending of Obamacare can be mitigated to some degree because they did try to end Obamacare and in essence end the stealing of Medicare funds by Obamacare and all those involved with them. Even the late Senator John McCain can be considered guilty for his vote in allowing the continuation of Obamacare in this criminal manner. A sad thing to see, for this was one of the last things Senator McCain did in his career. Democratic Senator Bernie Sanders spoke up and called for the use of Obamacare as a form of socialized medicine funded by Medicaid, which in this case is stolen Medicare funds and can be considered theft of Medicare funds. This is essentially confessing that the Democrats and the supporters of Obamacare were stealing Medicare money for Obamacare. The trend of evidence supports the facts that the activity of the 27% increase in Medicare premiums was stolen to support Obamacare. This would imply money for Obamacare or socialized medicine can also be called free health care, was and will be funded by the seniors paying Medicare premiums, which is impossible. There is not enough money. This is why they projected that Medicare will be bankrupted by the year 2020 and all the Medicare funds will be stolen. Can this be called a form of Soylent Green health care, as Hollywood motion pictures would call it, where the health care of older people is sacrificed for the health care of the younger people? Here is another example of the criminal trend of evidence of Obamacare stealing Medicare money. It is in the theft of Medicare premiums paid by the seniors of the USA, and that was stolen by the U.S. government and CMS, the people that collect the funds for Medicare and Medicaid, and they gave this stolen money to the users of Obamacare. In September of 2015, my brother and his wife, who are members of a Hollywood Motion Pictures Union, my brother said to me that the Hollywood unions told them that the Medicare premiums will be increased enormously in 2016. Then in November of 2015, BNR, also known as Business Nightly Report, a television Wall Street stock market daily summary show, said that the insurance companies that handled Obamacare medical insurance will stop handling Obamacare insurance policies because the profits were too low. Then in the first week of January 2016, the U.S. government announced that they were going to increase the Medicare premiums by 20% for the year 2016. Also in the first week in the year 2016 on channel 56-3 television, also known as MeTV in Los Angeles, California, had a commercial announcement that was presented by persons called Dr. Jason Buckland and Dr. Martin Gizzi. They told the people to contact them to find out the new subsidies that were available from the federal government to make Obamacare more affordable. With the prior information mentioned above and the perfect timing of the criminal activities, it is obvious that the U.S. government increased the Medicare premium rates for the seniors by 20% and put the money in Medicaid to subsidize Obamacare premium costs or free health care for Obamacare. The 20% increase in Medicare money that was put into Medicaid became the higher profits for the Obamacare insurance companies. These Obamacare insurance companies will now be able to continue to supply medical insurance for Obamacare. All this will be paid by the Medicare monies of the seniors of the USA. In the year 2017, Medicare increased the seniors' Medicare premiums another 7%. Thus, in 13 months, the U.S. government increased the seniors' Medicare premiums 27%. The U.S. government continued to threaten the people and the seniors that Medicare will be bankrupt by 2020, even though they increased Medicare premiums 27% in this time period, and with the addition of an enormous number of baby boomers entering and paying into Medicare, essentially more than doubling the rate of increase in Medicare premiums being paid into Medicare by the new yearly members, baby boomers of Medicare. With all this, there should be a surplus of money in Medicare, not a bankruptcy of Medicare in 2020. Bankruptcy of Medicare is happening because the U.S. government stole and then gave the seniors increased Medicare premiums of 27% to the Obamacare people to give them subsidized Obamacare or free socialized medicine. They stole this money from the seniors. They plan to use the seniors to front the money for socialized medicine for Obamacare and hope the country will take pity on the seniors and not let seniors suffer from the bankruptcy of Medicare and hope the U.S. people will bail out bankrupt Medicare for our seniors. Even with all this, the seniors will still have to pay the exorbitantly increased Medicare premiums, and the Obamacare people will get free or lower priced health care. The medical insurance companies that handle Obamacare insurance can be considered guilty of a crime called in receipt of stolen money, which carries a jail sentence, and criminal conspiracy of embezzlement of funds, since the amount of money is in the many tens of billions of dollars and getting bigger every month. Because the premiums are collected every month, the jail time should be significant. This may be the biggest private money theft in American history. What I'm about to say in the next paragraph is my opinion and reflects what I feel is true and what I experienced in my life. It should not be taken as something that works for anyone else or should be tried by anyone else. Frankly speaking, most young people really do not need health care because the young people do not get sick that often. To justify the exorbitant health care premiums, it is just an insurance company way of making more money. This is true because of what I just said. If the young do not get sick, then the insurance companies do not have to pay out from the collected premiums, so they keep more or most of the money. This is how medical insurance companies make money. Between the age of 18 to 65 years old, I saw the doctor once. If I had known better, I would not have needed to see a doctor at all. I could have healed myself by breaking a ganglion under the skin of my finger by banging on it with my fist. Usually, the period of time that healthcare is needed the most is in the few years before someone dies from old age. There is a new adage going around that I heard recently. If you do not die by 65 years old and you still appear to be healthy, you will probably live to 85 years old. What is the proof of this? They are selling life insurance policies to seniors from 65 to 85 years old, as advertised on television. One senior life insurance company even said, if you do not die by 85 years old, we will refund all your premiums that you paid to the life insurance company. This is unheard of just a few years ago. Life insurance companies usually wanted to eliminate your policy by 55 years old. Most of the people on Obamacare did not want any kind of health care unless it was socialized medicine. The money needed to pay for Obamacare financially infringed upon the lifestyles of the people that were forced to buy it. When I worked for a large company like Hughes Aircraft in Los Angeles, the vested healthcare benefits were free. I am sure many other companies did the same. This made private healthcare like socialized medicine. This is what others that were forced to get Obamacare wanted. If I had to pay for the provided healthcare that my employer Hughes Aircraft Company gave me, I would not have wanted it, even at a reduced cost. As it worked out, I did not need health care at all. It is too late for Obamacare to succeed. It may have worked in the 1950s when a house call by a medical doctor was $5 a visit. The price was at this level when doctors worked out of their homes instead of working in a separate office or out of a hospital, which drove the cost up. This is the end of the paragraph. This is a theft of Medicare and Medicaid funds collected from the seniors of the USA by the U.S. government and CMS and entrusted to them for safekeeping. I am not sure of the details of the following issue, but it will depend upon the U.S. government's policy with regards to a finder's fee or a recovery reward for the stolen Medicare premium money. Since the stolen money is in the amount of many tens of billions of dollars, the fees or rewards should be substantial. This money is continually increasing. The total amount of money depends on the actual amount of money collected and is cumulative. I wonder how much of the monies paid into Obamacare insurance companies will be paid out later as kickbacks to all the U.S. congressmen, U.S. senators, and presidents that have supported Obamacare after they have retired. There should be an independent group that monitors the monies that are handled in this manner. There is no difference between this and the selling of political favors while they are active politicians. It may be necessary to monitor the incomes of all U.S. government politicians for the rest of their lives to make sure that there are no kickbacks being paid out. This kickback money, in this case for the stolen Medicare funds, can also be considered as a criminal offense of in receipt of stolen monies by the federal politicians of the USA and CMS of Medicare and Medicaid. The U.S. government has to refund the 27% increased Medicare premium money they stole from the seniors since 2016 to now that was used to directly or indirectly pay for Obamacare and hidden agenda items. Medicare also has to drop the Medicare premium rates back to the 2015 prices. Obamacare was used to fatten the money pockets of the medical insurance companies. If Obamacare can get sufficient numbers of suckers to buy into it, they could have succeeded. They obviously did not. Obamacare insurance companies needed at least 30 million people to make it worth their while. They could not get this number of people, so the U.S. government increased the Medicare premiums 27% of the over 70 million seniors on Medicare, stole it and gave it to the small amounts of people they had in Obamacare and gave it to the Obamacare insurance companies to increase profits. There has to be a complete external independent audit of the Medicare and the Medicaid system from the year 1995 to the present date to determine the trend of criminal evidence so that those responsible will be suitably punished. I contacted CMS Medicare to supply me with the information needed to perform an external independent audit for the years from 1995 to the present under the Freedom of Information Act. It is not classified information, so it can be given to me. CMS has not responded to my request. Please note this, CMS. Your numbers used in your equations are inadequate for a complete external independent audit of Medicare monies. We will have to start the investigation at the top, starting with the former President of the USA, Barack Obama. People of the United States, I urge you to not vote for any Democrat and be selective on not voting for any Republican politicians that supports Obamacare. They are helping to steal money from Medicare to pay for Obamacare. And in doing this, they are about to bankrupt Medicare by the year 2020. Vote for anyone else. For those who do not know who are the biggest supporters of Obamacare, it is almost all Democrats and a small handful of Republicans. Do this to save Medicare for your children and for yourselves and for the many current seniors that depend on Medicare. Please see my additional postings on YouTube concerning why Roe v. Wade has already been overturned. It is entitled, Abortion Now Illegal. Roe v. Wade Overturned by Obamacare Laws. Supreme Court Decision. Please also see my YouTube posting why Hillary Clinton lost the 2016 presidential election. Sincerely, a senior citizen.